this is where your lens will attach. This part will go to the circulator, so she can connect it, or he can connect it to the machine. So this is the
Okay.
part that's yours, this is the part that's theirs. This is where the camera goes. The lens, I apologize. This is the light cord, which allows that lens to have light. So, which I cannot show you how it hooks up because
It's
you
a
need
fabric optic
fiber optic. Is that on your list?
light cord.
Yeah, fiber optic light cord.
Mine was, oh, here it is. Okay, I should go in order.
Do
Do you want a pen so you can mark it off?
Yeah, but I was kind of hoping to just go in order, and I don't know why those.
Here,
would
use
be-
this because this is
Kinda out of
erasable.
order.
Okay, yeah. No, no, you're fine. It's fair. It's yours. All right, that's erasable.
Yeah,
It's all cute.
on top.
So, your endoscopic camera, your fiber optic light cord. The Endo GIA is here. This is one, yeah, this is straight, and this one doesn't have a lot of, I don't know, so it's, I'm just gonna go with what it says here. I'm not gonna talk anymore about it. So here's your Endo GIA. If she's gonna keep this covered, it starts with the word auto there. Then the Endo clip applier is this. So think of it as little, basically little staples or paper clips are gonna go there. They're gonna get clamped shut. So you're applying clips with this. It goes on the vessel. They squeeze, it clamps down like a staple. They release, and it stays in there. I want to come back to that. Okay, your suction irrigator. Is that here?
Over there.
Oh, I was looking for the, okay, so yeah, here's your suction irrigator. So this, with the sharp poke part, this is what gets passed off to the circulator. They stick it into the bag of saline or, you know, maybe it's antibiotic solution or something like that. It gets poked in there. This part gets attached to suction machine. And so then you end up with, I think they also call it pulse lavage, pulse irrigator. So then this is irrigation. This has batteries in it. This is suction. So they can be squirting water and sucking at the same time. Obviously, they want that for this kind of surgery because it's all inside. So they'll spray like little car wash in there and then suction it all out. They don't always use it.
Is that what they use for the plume too?
No. That's because the plume comes on the outside. Anti-fog solution, Fred or Dr. Fog, also known as. So it's like Rebecca, Becky, Baxter, Beckaroo, like that. So I don't know that the order matters. Your Endo Kittner is here, which I think are cute. I stole some for Halloween once for a kid because it looked like
The
a
magic
magic wand. So these are what they would use to do like blunt dissection. So if they're trying to push apart something, when it gets wet, it becomes just a little abrasive, like the way you would use a Q-tip, basically. So sometimes they like these, or they can use it to kind of push stuff around because it's not going to poke at anything.
Like blunt dissection.
Mm-hmm. Yeah. So they usually come in packs of 3 or 4. I missed something. Oh, there. What'd you point at?
Oh, I was pointing so that way she could see what we were talking about on
Oh.
the camera.
Yeah.
Oh,
I mean, if you guys have suggestions, tell me. Whatever you guys want to see. I'm going to put it on YouTube, so
Right.
it's for your study benefit.
the J-hook. Where's our J-hook?
I didn't see one last time.
Yeah, I don't see it.
But it
We
looks like
had
a
the L
J.
hook last time.
It's, as you can imagine, it's something endo-looking, and it has a J-hook in the end.
It's used for coagulation, right?
Well, okay, so anything that has a metal tip can be used for coagulation, because they can be holding that and then attach the bovie here. And make, so you can attach the bovie here. So anything that's in there that has that kind of end, they can attach the bovie to. Yeah, these as well. So anything that has that can be to coagulate.
I was
They're
wondering
most
how-
of the time, 99% of the time, gonna use graspers to coagulate, but they can use anything that has that kind of attachment. So we don't know where the J-hook is, so we'll look that up. Keplinger bipolar forceps. So that's this guy. I only see this used in GYN surgery, but this is the Keplinger. And for those of you who've been following the infections at the DMC, all these things technically come apart. So there's a lot of moving parts to these things. So always just check your instruments. And then you see back here is another place you can attach it for Bovie if you need to. And they will with this. So they'll use this on, usually it's GYN that uses this. I don't see anybody else using it. The endo catch. So this, this you would, as the tech, you would take this out, hand it to the doctor, they'll put it in and then open this, and a bag will be here like for catching fish or in a goldfish out of a tank. And then they'll put the incision or the specimen in there, and they'll pull this out, and it has string attached to it that comes out with this. So the string is now outside the body. That's what they yank out. It's all disposable. The Veris needle is here. Some doctors do, and some doctors do not use this to start the laparoscopic surgeries. If they use this, they generally want a 10 cc syringe, but not always. You'll generally have that on the field unless you know for sure a doctor says no. The Maryland. Here it is. So you have a Maryland dissector. I think of this as from the Northeast, so that looks lobstery to me. So Maryland, I mean, again, these are things that work in my head because sometimes it is confusing. And don't be afraid to pick up and touch the instruments during the test. You're allowed to do that. So if that doesn't look like something to you, then pick it up, you know. It's like, oh, okay, because something will trigger your memory. It's in there. You know it. Somewhere. Endoscopic scissors, endo shears. They were here a second ago. Here they are. So.
We can hook those up to the ESU too.
Yeah, they can hook these up. These also articulate, so they move. Anything that has this kind of edge on it, you can articulate it. These things all articulate, theoretically.
You mean, does that mean like turn around?
Exactly.
Oh, rotate, I see.
Oh, okay. I didn't see that. That's cool.
Okay. That makes sense.
Yeah. So, yeah.
Awesome.
So they don't have to be like,
Like
I
twisting
got it in
around.
wrong. Yeah,
Okay.
exactly.
That makes a lot of sense.
So articulation is like
Moving
this,
around.
right?
Oh, yeah, like the
Yeah.
robotics.
Exactly. So the hook scissors. Did you guys have those? I don't think I saw them.
I don't think so.
No, you don't have those. Okay, the trocars. So again, just for order's sake, you have, here you have technically an 11 and a 12, but on your test it's 10 to 12.
Okay.
And then there's a 5, and then the Hassan.
So will those be together?
Probably
or-
not. I can't imagine she'd make that easy.
Can you just
So-
tell us the sheath,
Oh, yeah,
just
sure.
for the anatomy only?
Yeah, of course. Yeah. So your trocar, your sheath, and then the cannula size.
And then that's the part they're gonna tell you they're gonna throw in your mail. And
Yeah.
that's
So
what's
you're
going
gonna
inside.
give it to them like this, put together.
Mhm.
It comes in the package separate.
Mhm.
You'll give it to them, put together,
Mhm.
hand it off to them. They'll put it in the body. They'll take this out and
Throw it in the mail.
throw it on the mail stand.
Awesome.
So hang on to them all in one place. Some of them are very sharp, some aren't. Don't, as with everything, be organized and know where to get it if they need it back.
So which size would each of these be then? I'm a little
These,
confused.
on this one happens to say
Say the
11
number,
and 12.
but she might cover
But
it, so just know.
since she's saying 10 to 12, don't stress it.
You know
Say
that's
it's a-
5.
12 or
Put what's on the list. Put 10 to 12 trocar and
for
cannula.
both of them?
Yeah. I mean, if she said this is it, this is it.
Or ask her if
That's
you're
the
not
same
sure.
answer for both.
No, this one's a, wait, what do you mean?
'Cause
There's
She's
a
saying
ten-
if these were
There's
here
only
and
one
here,
there's
would you,
only
okay,
one
I understand your question. So if these were on 2 different tables, she's asking, would it be the same answer? Would you put 10 to 12 Trocard, 10 to 12? Do you know what I'm saying?
Was it in it not though? Because that one's a 11, that one's a 12
But
and that
that's
one's a
not
11.
This is 11.
Oh, I see what you're
Oh,
saying.
no, it's a 12, I apologize, yeah.
Well, no, she probably
The
just
sh-
has it there for us to see.
Yeah, I know that.
This, all right, somebody else gets to ask that question.
Rebecca, right on your card.
Freaking yourselves out. Okay, here you go, Rebecca. You got your heart still? Yeah. So I'm saying if she's going off this, then these are the category of 10 to 12. If she wants you to say specifically what they are, then I think that would defeat the purpose, because then she'd have to leave the numbers
Yeah.
visible. Because there's really, that would
No
be
way
hard
to
for
tell
you to,
that,
yeah.
yeah.
So, but ask.
Okay.
And then the 5mm trocar and cannula. The Hassan
Blunt.
blunt. And then your atraumatic grasper.
We just
Yeah,
had
we
it.
just had it. No.
It's
Or
the
no,
finger.
it's-
Mm-hmm.
I don't know where it went. We
It
just
really
had
was
it.
just here.
You just
So
had
the
it in
endo
here?
shears.
Promise.
Oh, here it is. Yeah, that's it.
Oh, the ones that got the, yeah. Look like a crocodile.
Atraumatic.
Crocodiles are not atraumatic.
A sweet,
about
a
A
sweet,
grandpa,
well-behaved
a
one.
grandpa
Aw.
crocodile.
So there's your atraumatic
But it does
grasper.
look like a crocodile. Now it's gonna be in my memory.
Oh, you're putting that on.
Specific pickup
For sure. That's why you
I
guys
mean-
ask questions.
Yeah, no, so this is probably, not probably, this is one of the more common instruments they're using during the whole entire laparoscopic procedure. They've got, there's probably 2 or 4 of these that are slightly different. They pick their favorites and you go with it. And that's generally what they've got the whole time. They're using that and the camera. Until they start doing something specific, like clipping off a vessel or cutting something or that kind of thing, so.
Would those graspers be like more for organs or that are going to stay in the body versus like, you know, your gallbladder? Would you use something more traumatic if you're taking the gallbladder out? For
Let me
Laploid?
finish saying the instruments and I'll answer that question.
Okay.
Don't forget it though, okay?
Okay.
Right.
Because we don't want to make that YouTube video too long. So here's your endo fan retractor.
Oh.
So pretty easy to remember as a fan.
It's also, what did we say? Articulate.
It articulates, yeah.
That's why we can touch the things on the exam.
Yeah. So why would you think it's a fan, right?
Because I look.
Because it looks like a fan. So trust your little heart. And then the aspirating needle here. So I was saying earlier, when you look at something like this and you might not be sure about what it is, again, look at it. Because if you look inside, it looks like a hypodermic needle that they would draw blood with or give you an injection with. And this looks like, you know, something you attach something to, right? The other end of it. So that's all it is. So they're going to put that into the gallbladder. It might be too big, too inflamed, too much bile, so they'll stick that in there and pull back on the outside. This will fill with the green gross, and you'll take that off. And that's your specimen if they wanted to, and that's your aspirating needle. So again, it's all wordplay too. So the word aspirating, aspiration, you usually hear that with anesthesia. So think of those things. Anything that helps you remember. And the endoscopic biopsy punch. Is that here?
Yeah.
Okay. Yeah, he's a little mean guy. Right. So that's sharp.
Does it have like a pocket in it?
Mm-hmm. It does. Yeah, sorry. And then I think anything like this has the ability to be hooked up to a bovie and burn. But yeah, this has it's a little cup. You can see how sharp it is. It looks like a knife. Honestly, most of these things are now disposable as well. So, yeah, and then what is not on here? So the hook
The
scissors.
J-hook.
Yeah, the hook scissors are not here. No J-hook.
Yeah,
And
we were looking for that one.
she doesn't have the
And those
the
endoscopes
5,
are
10, and 30mm endoscopes, like the actual camera lenses, or the camera, yeah, the camera lenses.
They're inside the,
They were out one day.
they're inside the thing.
Okay, we'll get them out.